Welcome to Doctors on Call. I'm Jenna Miller. Whether you are new in town, your insurance coverage has changed, or you're facing a health concern that calls for a specialist, chances are that you will be looking for a new doctor at some point. A family doctor is also a primary care doctor. They do their residency in a variety of medical fields, and they are certified through the American Board of Family Medicine to care for people of any age or gender. Whether it's a general practice, or family medicine, the physician and their staff aim to improve the health of all people. That's our topic today on Doctors on Call with our guest, family physician, Dr. Tyrel Somers.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Grove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Dr. Tyrel Somers received his medical degree from the University of Kansas School of Medicine in Kansas City, Kansas. He completed his residency at the University of North Dakota Center for Family Medicine in Bismarck, North Dakota. Dr. Somers is board certified through the American Board of Family Medicine and is a member of the Kansas Academy of Family Physicians, American Academy of Family Physicians, and the American Medical Association. His professional interests include chronic care management, gastroenterology, pain management, and psychiatric disorders. Dr. Somers has been affiliated with Russell Regional Hospital since 2015. Our phone lines are open at 1-800-337-4788, toll-free if you have any questions regarding family medicine on today's show. Doctors on Call brings you information which may be useful to you when you see your own physician. We'll go ahead and get started with some questions of our own while we wait for those first phone calls to come in. First of all, let's talk about if there's a difference between a primary care physician and a family physician.
Well, absolutely. The biggest difference between a primary care physician and a family physician is just in the distinguishment of whether they're recognized by the American Board of Family Practice or not. A family medicine doctor specifically goes through a residency training program in family medicine that kind of focuses on a variety of different subjects that they'll be trained on. A primary care physician can be a physician that just takes care of people on a regular basis. They can go through internal medicine, they can have a family medicine practice, they can even go through a pediatric residency, and that can qualify them to be a primary care physician as well.
Okay, excellent. Let's talk about when choosing a primary care physician, what a patient might need to consider.
Absolutely. One of the most important things that I always tell a patient is to find a doctor of which you have a connection with. Finding a doctor that you can talk to, that you feel comfortable with, because you're going to share a lot of sensitive information with them. You have to be able to kind of connect with them when it comes to a personality. If you feel like you can talk with your doctor, you're much more apt to kind of get information to them that's going to help them make diagnoses. You want to look for someone that's going to practice too in the way that you kind of want to. Every doctor has a different and unique style when they deal with patients, and so you want to find one that's going to kind of connect with you.
Okay, so in walking into your office, what might it be like that first time when a patient sees you?
Yeah, so the very first time I see a patient, I always talk with them personally about themselves, trying to get information from them about kind of what brought them in, also talking to them about their past history, their surgical history, also getting information about their family. In fact, that's one of the things that separates a family doctor from others, is we focus a lot more on family history and trying to glean information on kind of what they've seen previously in mom, dad, grandpa, and grandma, and how that relates to their overall medical care. We'll also ask a social history that includes like if you smoke, what kind of things you do for work, and kind of see you as an entire patient. I'll then do a brief examination on a patient. If they have any immediate needs that need addressed, I'll take care of those right then and there. And then I normally spend the last about 5-10 minutes letting them know who I am. I find that to be very, very important for patients. I tell them kind of a little bit about myself. I tell them how I practice medicine so that they can understand what to expect in the relationship between the two of us. And then we normally conclude the visit.
Okay, you talked about the board certification a little bit. Let's talk about how important it is to find a doctor who is board certified.
Yeah, a board certified physician is extremely important. Those individuals have gone through rigorous processes, testing, and are some of the highest knowledge individuals when it comes to finding a doctor. I recommend a lot of patients consider going with a board certified physician over a different one because they're not only showing that they have the intelligence and have gone through the certification process, but that they're continuing to go through the learning process and continue to gain more knowledge. They're the individuals that I think go above and beyond and really try to learn more in the medical field so that they can give knowledge to their patients.
Okay, very interesting. Let's talk about the age range of patients that you treat.
Oh, yeah, I see a variety of different patients. My youngest patients can be anywhere between a few days old to my oldest patient currently right now is 103, and I've even taken care of a 105-year-old. So that's one of the benefits of having a family doctor is that we can see a wide range of patients. It's just every day there's different ones that come in the door.
Excellent. So you don't have an age limitation?
Not
as
in the
far as-
least bit. Yeah,
Absolutely. Okay, let's talk about, do you encourage your patients to research their medical conditions that they're experiencing?
Absolutely. You know, there's good information now on the internet. It allows us to look up dozens of different things. That can sometimes get us into a little bit of a trap as patients sometimes go and look up a little bit too much and they get scared. They can get over questions about certain things. But going in with a base knowledge of what you think is going on with yourself and talking with your doctor about that is really critical, actually. It kind of gives us an idea of kind of where you're at and what you're thinking so that we can address that and make sure that we've taken care of your needs. If a patient comes into my office and they're scared that they might have some specific disease and really want to know if that's there or not, that should be addressed with them so that they can at least have their concerns acknowledged.
Now, there's a lot of information out there, so is there a concern that, like you said, they might read too much into it, or can they look too much, I guess is the question?
Oh, absolutely. Yeah, you can definitely overstudy and find too much information on something, or even work yourself up about certain processes and certain things. It's part of just what happens with patients. I would encourage an individual, though, if you have legitimate questions, write down those on a piece of paper, bring them in when you're going to see your physician, and sit down and talk with them about them and get those answers specifically. When you're looking for information, I would definitely recommend, though, that you find good, credible sources and good, credible sites. Don't go looking for ones that are just simple .coms that are just written by someone's opinion. You really need to go things that are written by either medical organizations or like hospitals that specifically target patient and patient education.
And then they need to discuss that with you if they found something.
Absolutely.
Okay.
Absolutely.
All right. Well, we are going to go to the phone lines. We've got a caller waiting to ask a question. This is Brittany on the line from Salina. Hi, Brittany. Go ahead with your question for Dr. Somers.
Good evening, Jenna. Dr. Somers. I recently sought out a second opinion for a mild medical condition I have, and my primary care physician made me feel as though I was betraying him. Should I feel guilty about this, or should I find a new physician who makes me feel that they respect my decision?
It's always really tough when you're dealing with a patient who's wanting a secondary opinion, because at times as a family care provider you can feel a little bit betrayed, for lack of a better term. Now, don't take that personally. It's definitely something that a doctor understands and that they face all the time. It's completely willing and completely acceptable for you to go and seek an additional opinion, because there might be a specialist that knows a little bit more about your disease process that might be able to help you. And so I really encourage you to not be bashful, not be ashamed of asking for a secondary opinion. As a physician, it's very important for us to just humble ourselves, be able to say, yeah, there's a chance someone else might know a little bit more and might be able to help you and get you the help that you need. That's an excellent question, though.
Okay, very good. Now, how involved in their medical care should a patient be?
Absolutely. They should be 100% involved in their care. I encourage my patients all the time to bring in medications, to know their list, to know who they see as a specialist, to know when they've seen them last, to be very, very active. Studies have shown over and over again that patients that are more active, that know what's going on, have better health outcomes. And so it's critical for a patient to have all that information down and to just know it.
Okay. When a patient is faced with a serious medical decision, how do you advise that person to make the best educated decision choice?
Serious medical things are always the hardest things because they weigh heavily on us in multiple different ways. Whether it be a decision that's going to affect you long term, whether it's a decision for a loved one, it's very, very challenging. The first thing you have to do is seek out information. Seek out the knowledge so that you can make the best decision. Whether that means talking with family members, whether that means talking with providers, talking with multiple doctors, whatever you have to do. Get as much information as you can so that you can make the best and informed decision. The next thing you need to do is lay out all the options. See what's available to you, see what can be done, and then from that information, try to glean what's going to work best. I can tell you this much right now, it's always tough and it's always challenging when you face those kind of things. But if you sit down and know everything that's possible, you're going to make the best decision possible for you.
Okay, and going back to Brittany's question about the second opinion, when might a patient need to seek out a second opinion?
That's a great question. One of the things that I often tell my patients when it's coming to a second opinion, if you come to a physician multiple times and they kind of addressed an issue over and over and over again, it might be that they've kind of hit kind of a brick wall, for lack of a better term, and just don't know where to progress from there. That's a great time to suggest a secondary opinion, because at that point we might need someone else to kind of back us up, or to even kind of rework you up and reevaluate you to see if there's something that we might have missed in our general workup. That happens from time to time. We're only human. We can only do so much, unfortunately. But whenever we kind of hit that stalemate, that's a great time. Another thing specifically is to go and look for kind of additional information. If you're kind of wondering if there's maybe something that's been missed, it's always a great time to ask for a secondary opinion.
Okay. And at what point does a patient need to seek out a specialist?
That's a great question. One of the things that you'll have to talk specifically with the primary care doctor for, because there's different conditions, different diseases in which getting a specialist involved from day one, hour one is extremely important. There's other things that a family doctor can take care of for long periods of time without needing a specialist at all. So it really just depends upon exactly what the individual is dealing with and exactly how severe the medical condition is. For the most part, a family doctor can take care of a variety of diseases without really the help from secondary opinions and specialists.
Okay, let's talk about the difference between urgent care and a trip to the emergency room.
Absolutely. In today's medical field, that's one of the hot topic issues that a lot of people are dealing with. An urgent care center is someone where you just go and you kind of see an individual. You have like a cough, cold, something like that that's quick, easy. You want to get a quick diagnosis, maybe a medication to help with it, and move on your way. Emergency care is for just that. It's for emergent situations. One of the big things that I always tell an individual is this: if it's something that you feel like you have to go in and be seen that second, or it's going to end up causing a major issue with you, or even side effects or possible negative consequences, you should probably seek out emergent care. But if it's something that's not going to make much difference, you just want kind of peace of mind, or you want something treated that's simple, probably urgent care is your better option.
Okay, so what is a trigger that a person might know I need to get to the emergency room?
Absolutely.
What's a symptom maybe that might regard that?
Let's use something like chest pain maybe to tell someone kind of when it's okay to seek an emergency room care and when it's okay to seek an urgent care. Emergency wise, if you have crushing chest pain kind of substernally, kind of in this area of the heart, that radiates up to the jaw, moves down, that comes on when you're exercising or moving, or gets better with rest, that's probably something that needs to be evaluated sooner rather than later in emergency room care. Now if you're getting chest pain that's associated with like eating, that doesn't really come on with exercise, it just kind of comes on there, can just kind of be watched and seen, or even be seen in urgent care. It all just kind of depends too upon the nature of the chest pain. For example, one of the things that we look for when we're docs is if it's like a reproducible chest pain. If I can push on the chest wall, or if you cough and that's what causes the pain, it's likely that that's not truly from the heart. It's probably from something else differently, and so that can be reevaluated. Again though, one of the most important things is if you do have the chest pain and you're worried about it and you need to know the answer now, you think it's going to be something that's going to cause problems long term, seeking out care sooner rather than later would be important.
Okay, excellent. We're going to go back to the phone lines. We've got Jan on the line from Hayes. Hi, Jan. Go ahead with your question for Dr. Somers tonight.
Hi, yeah, Dr. Somers. I've been dealing with something since June with my doctors. I'm going to a pulmonologist, and I went through an extreme stressful situation with my daughter, and I've got what they say is central sleep apnea and obstructive sleep apnea, and they put me on a CPAP, and they called me last week, and they said it's not helping at all, that I've had 63 central sleep apnea episodes in one night, and they want to put me on an ASV machine, and I'm just kind of confused that I'm not really understanding what's going on, and I'm not understanding the central sleep apnea part of it.
Absolutely, and that can be extremely confusing when you get different kind of questions or different kind of things that are told to you as to what to do next. When it comes to sleep apnea specifically, there's different kinds of treatments that we use to help individuals with it, primarily focused on getting oxygen to the lungs without any kind of problems. That can be a CPAP machine, or in your case, it's an ASV, which is kind of like a mini ventilator, for lack of a better term. It kind of helps promote more oxygen use. The difference is in like a sleep apnea that's obstructive versus a central sleep apnea is where the process is actually happening. In essential sleep apnea, it's primarily occurring because of something happening within the brain signaling abnormal breathing patterns. The ASV helps with that because it kind of assists people in breathing, for lack of a better term, whereas the CPAP machine just kind of pushes pressure through. And in an obstruction process, like an obstructive sleep apnea, you just kind of want to get through that obstruction to allow the person to breathe a little bit more comfortably. So in this case, it sounds like you may benefit from actually being on an ASV if they truly think your apnea is happening from a central process.
Okay, hopefully that helps her out a little bit. We've got another caller waiting to ask a question. This is Pat on the line from Hayes. Hi, Pat. Go ahead with your question for our doctor tonight.
Yes, I was wondering if Dr. Somers had any suggestions when you have a family member that is in some, you know that they are in need of medical care, but they are refusing to get the help they need, or at least to go and find out what can be done. So that's my question. What can you do to encourage someone to get to a family, a doctor, or to a doctor in general? Thank you.
So yeah, that's an extremely tough thing to deal with for sure. Having someone that is refusing to get care for a variety of different reasons can be a tough thing for any family member, especially when you know they're suffering or when they're dealing with hardships. One of the things that I would tell most of all is to understand maybe the reason why the individual is doing that. Are they avoiding it because they're scared or they don't fully understand what's happening? Maybe if you reach out to them and kind of tell them exactly what you're thinking and what you're worried about, that might help a lot, to be honest with you. Another thing that might be important is the fact that they just refuse to see it. They just don't want to address it. And so talking with them and just saying, well, what is the problem? What's the obstacle? And trying to figure it out and how to get through that would be extremely important. One of the things I tell people all the time, though, is that we're people, we're human. And the nice thing about that is we get to make our own choices. So you have to respect and understand that they're going to make their own decision, whether it be good or bad, and love them and take care of them regardless for it.
Okay, great. I wanted to go back real quick. We were talking before our calls about the emergency care compared to the urgent care. One of the differences is that urgent care has specialized hours, I would say. So what happens if a person is on the fence? I don't know if this is emergency, but urgent care is closed for the day. What do you suggest?
So the first thing is dealing with comfortability. Like, how comfortable are you with taking care of this until the urgent care clinic is open? If it's something that's very minor that you think, yeah, I can probably do this, it's probably safer to just wait until the urgent care and to be seen then, to be honest with you. If for some reason you're just concerned and don't know what to do, emergency care is there for you. It's there to kind of do. I tell moms and dads this all the time when they bring in sick kids. I would rather go into an emergency room and see a sick kid and reassure a parent that nothing's wrong than to sit there and make them worry all the night through if they're concerned that their kid is very, very ill. So if you're ever in doubt, if you're ever in question, if there's something that's very worrisome, bring them in and we'll just take a look at them. That's always why we're there.
Okay. And speaking of children, when might a family need to see a pediatrician compared to a family physician?
Yeah, that's a great question. One of the things I'll say for sure is if you have an individual, like a kid who has very specific needs that is very, very challenging to deal with, a pediatrician has specialized skill in dealing with children. They definitely can see that individual and will definitely provide excellent care for him. A family doctor can be used for regular run-of-the-mill children's care, though. We take care of well visits, we give vaccinations, we can kind of do cough, colds, those simple things. And so I would say that if you have the option to get a family doctor and they're closer to you than a pediatrician and your kid doesn't have any unique needs, it might be more acceptable for you to see a family doctor. And the nice thing is once they've transitioned into adolescence and even into becoming an adult, they can just keep that doctor the entire time. As compared to with their pediatrician, they'd have to say goodbye to him and get set up with a family doctor or another primary care provider at that time.
Okay. You spoke about well checks. How important are those wellness checks?
Extremely important. They're one of the things that I try to get my patients to realize how important and how critical they actually are. Because at a well check, our minds change as a doctor. I'm going to be honest with you. When I look at a patient in a well check, or I look at a patient for like an acute visit for something that's wrong, I approach it completely differently. In a wellness check, I'm looking to see what kind of preventative things I can do to help them long term. I'm looking at cancer screenings. I'm looking at immunizations. I'm talking about medications and reducing those. and trying to find a way to make their life better so that they don't have to deal with bad things that are coming up. When I get an acute visit or I get someone following up for diabetes or hypertension, that's what my mind's focused on. I'm very much trying to just take care of those illnesses and not worrying so much about, when was the last time they had a colonoscopy? When was the last time, if they're a smoker, they had lung cancer screening? Have they had their immunizations recently? We just don't have the time to go through all of that stuff, unfortunately. A wellness visit allows us to address all of those things to make to make sure the individual is getting what they need and make sure that they're setting themselves up for success.
So give us an idea of what is included in that wellness check.
Yeah, so a wellness check very much has a physical examination with the physician. We review medications with the individuals to make sure that they're not having interactions, to make sure that they're on the right drugs at the right doses. We also will check preventative kind of care, whether that be cancer screening, whether that be immunization screening, whether that be any number of different things that we can do and help with the individual, kind of focusing more on preventative long-term care rather than just preventing on specific diseases or specific processes.
And how often does a person come in for a wellness check?
Yearly. Everyone should come in at least once a year to see a doctor for a wellness check.
Excellent. Now, how often should you see your physician if you believe you are just in perfect health?
If you're in perfect health, you should at least be seeing a doctor once a year for your wellness check, for sure. If you have underlying disease, it's probably better for you to talk with your physician specifically because different disease states require you to see a physician different times. Also, certain medications can require you to see a doctor more frequently. It all just depends. So if you're ever in doubt or ever in question on how frequently you should be visiting with your doctor, talk with them, say what they say, and go from there.
What is the outlook for flu and cold season this year? I know we're kind of in the thick of it right now.
Yeah, we've had a really interesting cold season this year. There's definitely been some weird viruses kind of going around that kind of persist and last longer than the average virus. And so I've seen a lot more people be sick for longer periods of time. It's always disheartening when you go into a doctor's office. You think you've got a really bad cold that needs an antibiotic, when truth be told is you've just got a virus that just won't give up. And that's what we've really been seeing this cold season as compared to other ones, is that most of the colds that people are getting are just persisting for even longer. Now, we haven't seen as much flu quite yet, but from looking at data from the CDC, there's a lot of things coming over from like Colorado and other places where it kind of becomes a little bit more severe and they're kind of ramping up. And so I fear that if you haven't had your flu vaccine, that it could be a really, really rough flu season for you coming up here soon.
Now let's talk about the antibiotics, because I know, like you said, people go in thinking they're just going to get an antibiotic handed over to them when that might not be the solution. So
absolutely.
Explain that a little bit.
So antibiotics are a great thing. In fact, it was one of the things that revolutionized medicine at the very early of the 20th century, saved lives, to be honest with you. And we're wonderfully blessed here now that we have such great drugs here available to us. The problem is that antibiotics, when they're used incorrectly, can lead to a lot of harm for patients. One of the biggest things that it can lead to is what's called antibiotic resistance, which basically means that we're not able to fight the diseases that we need to with the drugs that we have because we've overused them. And that can lead to really, really, really bad complications for patients. One of the things that's really hard to convince an individual, though, is when they're dead set that they need that it's not okay, that they get it, they want it right then and there. And I understand that as a physician, but it's really, really important that you understand that if a doctor's not giving you an antibiotic, it's probably because you don't need it at that time and we don't want to breed that resistance. Another thing, antibiotics react with a lot of drugs, and so you got to be extra careful when you take them that they don't cause problems with the other medications that you use.
So what's the difference between an antibiotic and a probiotic, and are you encouraging of the probiotics?
Yeah, so an antibiotic is a medication that's specifically designed to help destroy a bacteria, for lack of a better term. They do it in a variety of different ways. A probiotic is actually a pill that's been synthesized with helpful bacteria in them. Probiotics are great medications. They can kind of help regulate problems that people have with indigestion and with their bowels. They can also help kind of restore normal biotic flora in an individual who's received antibiotics. I often recommend whenever I give a strong antibiotic for an individual to be on a probiotic because the symptoms that they can have and the problems that they can have from it are typically mitigated. They're much less because of the use of a probiotic.
Now, is a probiotic something that somebody can be on all the time, or do you recommend that?
It depends upon the individual. Everyone's unique. For the most part, an individual can be on a probiotic without having any problems. There are certain individuals in certain cases, though, where being on a probiotic can be bad, especially in individuals that have weakened immune systems. And so I often advise patients that if you have a question about the probiotic, you should probably talk with your physician and just double check to make sure. But for most patients, it'll be safe.
Now, you mentioned the flu shot earlier, but what else can a person do to try and prevent themselves from getting colds, flus this season?
The biggest thing is hand hygiene, making sure that you're keeping your hands washed, making sure that you either use like an alcohol-based agent or just soap and water. That helps reduce the spread of infection by more than anything else. The next thing is the vaccination, which we already talked about. It's really important to get that. And then finally, limiting yourself so that when you do get sick, you're not spreading it on to somebody else. So if you have symptoms, if you have a fever, if you have a really bad cough, if you have a runny nose that's getting worse and worse and worse, it's probably best that you kind of limit yourself and kind of isolate yourself instead of spreading it on. That's probably the 3 biggest things I can encourage people to do.
And there's some differing opinions out there about the hand sanitizers. How do you feel about them compared to the hand washing?
So if you look at kind of the benefits of both of them, you have to use them both correctly in order to get truly a good effect from them. For the most part, the alcohol hand wash for how we kind of wash our hands nowadays is just as good as doing a hand washing. The problem with the hand washing is that for it truly to be effective, an individual has to wash for at least 30 seconds. And most of us, when we get to the thing, we da-da-da-da and done and walk off kind of thing, and that makes it tough.
And how important is to use soap with your water?
It's extremely important. Without the use of soap, it's like you don't even need to be doing that hand washing. It's much better. So make sure that you have an agent, whether that be the alcohol-based one that you rub into your hands or the soap. That will make the biggest difference.
And what about supplements? Are there any, you hear a lot about the vitamin C. Is there any truth to the supplements out there?
Unfortunately, there's not. Vitamin C definitely has a benefit in other disease processes, but when it comes to kind of flu prevention or cold prevention, it really doesn't have the science behind it to prove that that's truly helpful or beneficial.
Okay. Well, our thanks goes out to Dr. Tyrel Somers from Russell Regional Hospital. Thank you so much for being our guest tonight. On our next Doctors on Call, we'll be discussing heart disease. You can email our questions for our next program. That address is doctors@shptv.org. Thank you so much for joining us for Doctors on Call. I'm Jenna Miller. We'll see you next week.
Is made possible in part by an underwriting grant from Gove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.